Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob SCHRUPP, physical therapist.
Brad HEINECK, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Hi folks, I'm Alex, physical therapist assistant,
I'm Mike, physical therapist assistant.
and this is the Total Knee Replacement Fitness Program. This is your guide to achieve maximal knee bending.
Bring it to the max.
Bring it to the max.
Is that a song?
You would know better than me. You're the music guy.
Anyway.
Two things to note here. Number one, I'll do number one.
Okay.
Pain control is very important. Practice your deep breathing. You might have to refer to previous videos we did these things. Practice your deep breathing. And use your pain meds at least 1 hour prior to doing your exercises. And you should be staying on your scheduled routine for pain meds, especially early on.
Yep. Number 2 is swelling management. So it's very important working towards your range of motion of your knee bending. If you have more swelling in your leg, it's going to be harder to bend the knee. So practice rice, rest, ice, compression, elevation are all important things.
Yep.
Remember, you could do numerous ones at once. Lay on your back, watch some previous videos we have. Elevate your feet up above your heart. Put some ice pack on there. Make sure to have a layer between the ice and your knee skin.
Yep.
And yeah, just try to get the swelling out of there.
And get moving, activity.
Yep.
Functional range of motion norms. Now these are norms, so if you're not in these categories yet, don't be nervous.
Don't be discouraged. You will get there. Everyone's different. These are just recommendations.
Yep. They say 0 to 2 weeks, your bending, your flexion range of motion should be 65 to 90 degrees. So 90 degrees is that right angle.
If you're not there at 2 weeks at 90 degrees, don't force it.
Yep.
Just take your time. These are just norms.
Yep. 2 to 6 weeks, they say you should be about 115 degrees. Mike and I have worked with a lot of older people.
Yep.
And they, sometimes 115 is what they get to by the end, and that's great for them. So.
Yeah, it's all going to depend. Your surgeon will tell you if they don't expect you to get full range of motion back. It depends on how long you waited to get the knee replaced and what damage was done, basically.
Yep. And 12 weeks, I mean, if you're probably a younger person, very active, 125 to 135 degrees. 135 is all the way heel to butt, so.
Yeah, I don't honestly see that range
No, I
a
don't.
whole lot. Most of the time, we're looking for 120.
I don't think I've ever seen 135, I'm going to be honest.
No, not
so.
a knee replacement, but
Some functional things, just to put in perspective why you need to get your knee bending. Walking takes 65 degrees of bending.
picking up an object takes 70 degrees of
Yeah.
bending.
They say climbing steps, this is one step after another. Normal stair climbing is 85 degrees of bending of your affected leg.
Going from standing to sitting. No, I said that backwards. Standing to sitting.
Yeah.
You need 95 degrees of bending at least.
And they say squatting, I thought this one was surprising. 150, squatting or sitting cross-legged, 115 degrees of bending. Squatting, I don't know why that was.
Ask your surgeon if you can cross your legs too,
Yeah.
but it's
Yeah.
not all of them like that. But
Yeah.
150, yeah, I guess if you
Maybe.
squat decently.
Yep.
And in and out of the car or the bathtub, you commonly need 125 degrees of
Yep.
bending. That can vary depending upon your vehicle or if you have a seat in your bathtub or
Yep.
not.
Or how much you can compensate with other muscles techniques. So.
Yep.
All right, on to the exercises. Now we're going to go phase by phase, 0 weeks to 6 weeks plus. So we're going to start
We'll specify exercises just to focus on knee bending.
just to focus on knee bending. Yes, this is 0 to 1 week. So that first week after surgery, we're going to start. There's 2 exercises here. We're going to keep it simple. Number 1, do you want to demonstrate or you want me to?
Supine heel slides, I'll demonstrate.
Okay, so basically what he means is laying on your back, getting your knee bending. So
You don't need a knee guide if you don't have one. You can just use your sock.
all right, so
Foot.
We're using knee glide. It does work a lot better with the knee glide, I will say.
Yeah, but smoother.
Yep. So all Mike is doing, he's laying flat. You know, this is early on where you might not want to get out of bed. You know, you might be in a lot of pain, but you got to get it moving. So
0 to 2 weeks, you're probably going to bend it like this far. I'm
Yeah.
exaggerating how
Yeah.
much. That's full range of motion.
And you might need to use your leg lifter for a while too. That you
Yep.
might refer to previous videos, a leg lifter.
You can also use your other foot if you can reach
Yep,
and help push a little bit if that's comfortable. If that bothers your back, don't do that.
sure. Okay, so that's laying on your back, getting your knee bending. You're not probably going to get a lot of motion, but it's a starting point.
Yep.
All right? You want to hand me the knee glide?
No,
Thank you.
toss
you,
it
sir.
at you.
All right, so we're going to say my right knee I had replaced. So we're going to get in the seated position. You know, to start, you're not going to go for a long duration. I'd say 3 to 5 minutes is going to be plenty that first week.
Yep.
So you might have to bring the knee glide out like this. Your knee's not bending much. You might just start going this far.
And every so often, like every 30 seconds or minute, just try to bring it back a little
Yep.
more. Hold it for like 10 seconds.
Yep.
Just so you feel a stretch, just touching the pain, not forcefully bending it where it hurts.
Yep, it's not about speed, as Mike says. It's about getting your foot to come back further underneath you.
Yep.
So that's 0 to 1 week. Those 2 exercises, that's it.
Yep.
1 to 3 weeks, we want you to do this 3 times daily. Increase the duration a little bit, maybe 10 to 15 minutes per session. So,
Yep, just take a little bit longer. You're probably feeling a little better.
Yep.
The first exercise is going to be just continuing the knee glide.
Yep.
This is one of your optimal things. Focus on that range of motion and
Yep.
getting the knee flexion back.
so as it bends more, you might be able to bring the knee glide back a little further. But same concept, go slow, pull it back underneath you. At this point, you might be able to push a little bit with your uninvolved leg and really stretch it out. But,
Yep.
let pain be your guide. Don't try to
You don't
get
have
it all.
Have a knee glide. Just use a towel on the floor.
Yep.
Works pretty similar. This is just a little easier on all
Yep.
surfaces.
Our
so.
patients have never regretted getting the knee glide, though. So I think
Yeah, we send them home with them, and then they just bring it back when we're done, and they've all thoroughly enjoyed using it.
Yep.
So.
Number 2, this is an easy one, but very, very effective. I love this one. So all you're going to do is your feet are going to be flat on the ground.
Just imagining him like the knee patients complaining at him after doing
Oh, yeah.
this one.
Yep.
But it
Yep.
works.
It works.
It won't hurt. Just it stretches.
Oh, yeah. It might hurt a little bit. Don't lie to 'em. All right. So your feet are flat on the ground. All you do is you scoot your butt forward. And do you see how my knee is bending a little more? And then I'm just going to hold it for 10 seconds or so.
Yep, so the goal is keep your feet planted. You probably have to have shoes on or grippy slippers or grippy socks. If you're just in bare feet, it's going to slide too
Yep.
much. We also have people do this in a wheelchair too if they're
That's
more
right.
wheelchair bound in the facilities. But this is just a good way. There, you are in control of how much pressure you're doing. No one else is pushing the pressure.
Yep.
Again, don't forcefully get it because you want a better number. Just do what you can do for that day.
I think we can both agree when the patient's in control of the situation early on, they do a lot better.
Yeah,
So-
otherwise if we force them back, they yell at us a little more.
Yep.
In
So-
a nice way.
So start with maybe 5 repetitions, move up to 10 as you feel comfortable, and really try to get your butt to the edge of that chair. Make a goal of it. Number 3, this is sit to stands with your knee bending. I like this one. It's functional. You get a little strengthening in there too. So this chair probably should have armrests at this point, but you're going to stand up, and then most people want to, kick their bad leg out and sit down, but that's not doing anything for your bending. So early on, I'm not expecting you to keep your foot all the way back, but try to get it back as far as possible. Reach for those arm rests. Sit real slow. See how the knee is bending, bending, bending. And if that's too much, then kind of stop yourself and bring your foot forward.
This is a good test to do week by week too. Early on, you'll see how far your foot is out, and then as time goes on, like a couple months, you'll probably start noticing they're more even.
Yep.
So just
That's-
another way to see progress.
That's the goal, is equal weight bearing, equal bending of your knees when you're standing, sitting. Number 4, you want to take this one?
No.
Yeah, you do.
Yeah, I
Of
do.
course
Where
you
is it? Number 4, walking with focus on knee bending.
Mm-hmm.
So while you're walking, you just want to make sure your knees are actually bending.
I'm going to get out of the way here.
You don't want to do the old peg leg and like whip your legs straight because it
Yeah.
hurts like this. You want to allow it to go forward and then bend as it's going back.
Yep,
So
and then when
this
you're
leg-
lifting it off the ground, bend it too. Yep.
Yep, so just focusing on trying to get a normalized gait pattern. You might still be using a walker at this point in time or a cane, depending upon your mobility. Keep using it as long as you need, and then eventually, wean off if it's appropriate for you.
Yep. Yep. All right. Then we're moving on to 4 to 6 weeks. This is where we're going to get a little more aggressive. 3 times daily again. Maybe bump it up to 15 to 20 minutes of exercise per session. So
Yes.
I don't need to show it again, do I? Continue with the knee glide.
Yeah, the knee glide is in every phase of this. Keep working at it. You probably have it closer to the chair now because you're bending a little more.
Yep.
Range of motion should be your number one priority these first 6 weeks. Strength will come back later.
Yep.
Just keep focusing on the bending if
Yep.
that's your issue. Straightening will be a whole nother video,
Yep.
but
The knee glide, I would say, bump it up to doing 8 to 10 minutes now. Don't do your, 3 to 5 minutes. Bump it up to 8 to 10.
and you don't just have to sit there and do that. You can breathe while doing it or watch TV or something
Yeah.
to get your mind off of it because it's going to be a bit of discomfort
Yep.
while you're doing it. So just try to breathe through it, watch some TV, distract yourself.
Yep.
Just enjoy your time with the knee glide.
Number 2, we just did it in the 1 to 3 week phase 2, the scooting forward in the chair stretch. But try to get that foot underneath you now, equal with the other foot. So,
Yep, just progression more and more just to try to get a little more knee flexion as long as it's tolerable for you.
Yep.
Number 3 is a different one. It is in some of our other videos. It's called a step stretch.
sure.
So Alex will show here. We're using a chair. This would be like your handrail.
Yep.
Do not go. This would be like 2 steps up. You don't have to go this high right away. I would just start with a normal step height
Sure.
like this. But he's just going to put his surgical knee up on there.
I'm tall, so I can get away with doing this. Not many people will be able to, but use your imagination here. This is a railing on steps.
Yep. Hold on and lean forward into it. Obviously, Alex is exaggerating
Yeah.
because most patients will not be able to bend that far.
No.
Most will start way back.
Yep, sure.
And then they'll try to bend into
Right about
it.
here, maybe.
Yep, and right when you start to feel the pressure, just stop there. Do not forcefully bend it even more.
Yep.
You're in control of it again.
And a little trick when you get to the end, try dropping your butt down. You get a
Yep.
few sneaky degrees there.
It's a very similar concept to the chair scoots. It's the exact same thing. Your foot is planted. You're just in a standing position now, and you have a little more leverage to
Yep.
stretch a little more. Typically wait a little longer to start this one because it is more aggressive than the other ones, and we don't always want to be real aggressive right away
Right.
with this. So,
Yep. And we don't want to put you at risk for falling, so we like to wait on that one a little bit.
yep.
And then, again, the walking with the emphasis on bending the knee. I even tell people to exaggerate when they're walking. Act like you're going to kick your butt when you're,
Isn't that how you walk all the time?
well, kind of, but
No.
at bar time. Well, we can't throw that in there, Bob and Brad said.
Number 5 is functional knee bending with ADLS, activities of daily living. So just try to go about your day. Try to think about letting your leg work like the other leg. Just let
Yep.
it bend. If you're picking up something low, try to use it. Don't baby it as much anymore.
Yep. Getting in and out of a car, anything like that.
Yeah, do the stairs again if you're comfortable with them. There's other videos on how to do stairs correctly. Maybe use that leg to lead going up the stairs now.
Yep.
It all just takes time, but these are all tips to help get your knee bending a little easier.
Yep. When you're getting dressed in the morning, bend your knee, to get your socks and stuff on. Don't be.
Yep, try to maybe get rid of some of those
Compensating.
sock aids and other things you've been using early on.
That's right. So this leads us to 6 weeks plus. At 6 weeks, we expect your range of motion to really be improved. You're feeling good. Now at this point, I would continue with the step bending stretch, on your stool or your chair. I would do that once or twice a day, I'd say, for 15 reps.
Yeah, you still want to keep some bending focused. Depends on your range and how comfortable it is. Sometimes, your knee bending might be far if you're stretching it, but just in normal, if you're not stretched or warmed up, it might not be as far. So still focus on it if that's an issue.
Yep.
You will know eventually over time when you can stop focusing on it.
Yep. But the main thing in this phase is to, again, bend your knee functionally with everything you do at 6 weeks plus. I mean, you should be trying to bend that knee like you were before surgery. It's
Or
probably
even-
not there yet, but
Might be even better than
Probably
before
bet-
surgery,
that's it.
depending on
that's
the.
a very good point.
Yeah, some people it's pretty bad before surgery, but
Yep. So,
All right.
All right, this is your guide to get max knee bending. You have no excuse.
Check out all our other videos related to Total Knee Fitness Program. You can find it on bobbrad.com/programs.
Thank you.
Thanks.